Good morning, everyone. So, today we are going to talk about PCOS and fertility and egg quality and all of that, and how you can improve your egg quality if you have PCOS. So, I'm bringing on an expert today to talk about all the things that you can do to help yourself if you do suffer from PCOS, because it is something that is pretty common from my understanding. Angela on here to chat with us about this very important topic. All right. Hello.
Good morning. How are you?
How you doing?
Great.
Good. Well, thank you so much for coming on here. PCOS is pretty prevalent, in people with, ovaries and all of that. How common is PCOS before we dive into?
Yeah, they say, well, the research shows around 10% of the childbearing population.
Got it. Interesting.
Yeah, it's actually the most common endocrine disorder among people of childbearing ages, too.
Really?
Yeah,
Did
people don't
not.
realize that PCOS is really an endocrine disorder. They just
Oh,
think it's about, your ovaries.
right. I have PCOS and I had no idea.
Yeah.
Anyway, okay. Give your background. Who are you? What do you do? All that good stuff.
Yeah, I'm Angela Grassi. I am the founder of the PCOS Nutrition Center. And I also have PCOS, which is polycystic ovary syndrome. And I enjoy helping people become parents and helping them improve the quality of their lives and really optimize their health with good nutrition and supplements.
I love it. I love it. Because I always thought, so when I heard of PCOS, I think, okay, cyst. Oh, there's cysts. So I have cysts on.
Hmm.
It's like, that sounds awful and terrible. And what does that even mean? But then, as I learned that that's not really exactly what it is. And you actually do you like make more eggs? Like you can make more eggs, but the quality is not as good.
Exactly. People
Yeah,
with PCOS tend to have tons of little immature follicles, little eggs that haven't matured and are poor quality. So a lot of the focus with nutrition is really improving the quality of their eggs and getting them ovulating.
right. Because you think that, oh, I have a lot of eggs. It's amazing. And also scary that I'm going to have like multiples. But a lot of people who have PCOS suffer from, miscarriage and or infertility because of it, right?
Unfortunately, yes. Yeah, it's really common because of the immature egg quality.
Right. And then also that ovulation, like your cycles are irregular a lot of times. Mine are.
Yeah.
Um,
Yeah, PCOS is the most common cause of ovulatory infertility.
oh, wow. It makes sense.
Hmm.
Yeah.
Hmm.
So what can we do? So I didn't, first of all, I didn't even know I had PCOS. I had irregular periods, but I just thought, oh, I have irregular periods. I was a nationally competitive gymnast. So, my cycles just has never been regular. And I didn't have any symptoms besides that. Like I didn't have heavy periods or painful periods or anything like that. So, um, is it, so how do we test whether or not we have PCOS? Let's start there.
That is a good one to start with. So, PCOS is really a diagnosis of exclusion. So, they have right now agreed upon criteria that states a person has PCOS if she has two of the following three. So, the first is the hallmark sign of irregular or absent periods. So, eight or fewer periods in a year.
Right.
That's a hallmark sign. And you can have regular, monthly periods and still have PCOS. So, that's part of the problem with this criteria. So that's criteria number one. Criteria number two is if you have elevated androgens, which are like testosterone. If that is elevated, that is a red flag for PCOS.
Okay.
And then the third is if you have those immature little follicles on your ovaries. So they would do a ultrasound and take a look and see what's going on.
Got it. And then what about like a blood test? Because I
Mhm.
had high AMH levels the entire time.
Yeah, so typically in PCOS, we see really high AMH, which shows that you have all these immature follicles. And then they can do the blood test to see if you have the high testosterone too.
Okay, got it.
Yeah.
Somebody asked if we could discuss prolactin. Is that related to PCOS?
Prolactin is a hormone in the pituitary, and prolactin actually is where it can affect some of the female sex hormones, like luteinizing hormone. It's not part of the diagnostic criteria for PCOS. If your prolactin is high, you want to get that looked at. Sometimes you can have what we call a pituitary tumor, like a benign tumor that is causing too much prolactin, and that's going to throw off levels of like your luteinizing hormone and follicle stimulating hormone.
Got it. Okay, so that's separate than PCOS. Like,
Right.
not always. Okay,
Right.
got it. Do you have information on your website about any of that, or no, because it's not PCOS related?
For prolactin, not so much.
Okay. Okay.
Yeah. But I have plenty of other stuff.
Okay. You have a ton of articles and a ton of, supplements and nutrition stuff. So we can kind of dive in. So, okay. So we find out, we have PCOS. Look, a lot of people that I work with, are part of, most of whom are lesbians, right? So we don't think we have any issues getting pregnant. We just don't have all the parts. We didn't, for us, for example, we couldn't try to have a baby before. So we didn't go into a fertility appointment saying like, hey, we're struggling right now. Can we have PCOS? What is that? So we get tested, we find out, okay, hey, we have PCOS. What can we do? What are some things we can do to improve our egg quality, improve our fertility chances, all that good stuff?
Yeah, there's so much that you can do. I know like so much of this like might seem out of control, the whole fertility process and getting pregnant. But, the nutrition and how you feed your body and how you care for your body is something that you can control. And since we're talking about rainbows and connecting rainbows, I always recommend eating the rainbow. So that means getting lots of different colors from produce, like fruits and vegetables, because they have what we call antioxidants. And antioxidants help improve the quality of your eggs. So that is going to be really key. So lots of fruits and vegetables, whole grains is really great. A lot of fiber helps improve gut health. And then eating more fats like unsaturated or omega-3 fats. So that's going to be like if you eat fish or seafood, if you like avocados, if you like any seeds or nuts or nut butter, those are all great for improving the quality of your eggs.
Okay.
And we actually see that protein in the form of more plant-based protein, like eating more beans, eating more tofu or soy, as opposed to red meat, can actually help improve fertility. And then we see that taking maybe a prenatal can really help just to boost the quality of your eggs, get your body ready for pregnancy.
Should be doing that.
But a good quality prenatal is going to have choline in it. And choline can actually help with egg quality, and it's so important in that first month when you get pregnant. Just like folate is important. You hear folic acid or folate. So that's really important to have too in the first month of pregnancy.
And I know I learned from a friend of mine that eggs have a lot of choline, like a really good food to be having when you're pregnant. And I remember I was like, okay, I'll eat I love eggs, so I'll eat all.
Eggs are a fantastic food.
And do you have a list on your? I'm sure you do, and I can link to some articles that you have on, just so that people can have a list of the different foods and.
Yeah, cool. Absolutely. At PCOS Nutrition.
Awesome. We're gonna tag you. So we do.
Okay, cool.
Okay, people have been asking questions, but do you want to add to anything?
There's what else? We see that like some supplements that can help other than like taking a prenatal, having vitamin D. So most people are deficient in vitamin D, and people don't realize that vitamin D is a vitamin, but it's also a hormone.
It is?
Yes. It's the only, that's what your fun fact of the day is, the nutrition fact. Vitamin D is a vitamin, but it's the only vitamin that's also a hormone.
I had no idea.
And because it's a hormone, there's vitamin D receptors in all your cells, and especially your eggs. And so we see that vitamin D has a significant role in egg quality and ovulation.
Oh.
Yeah, so checking your vitamin D levels, you can ask your doctor to do that, and supplementing with vitamin D is going to be really key. And then keep in mind that vitamin D is a fat-soluble vitamin. that means you are going to absorb it better in the presence of some fat. Like if
Oh,
you have some peanut butter there, some avocado, like with your breakfast, that's going to be really good to absorb that vitamin D.
so many things that we need to think about. And when should we start kind of really looking at our diet, our supplements, and all of that when we're kind of wanting to get pregnant? Like when should we start this process? Obviously, as soon as, but what is
Yeah, as soon as possible would be good because you want time for those eggs to really mature and be as good quality as possible. So, yeah, as early as possible, that'd be really good.
right? And I've heard that your egg, that the egg that is going to be released starts developing, is it like 90 days before it's actually released, something like that?
Approximately.
Okay. So at least 3 months before you want to start trying is really a key time to be
That
looking
would
at.
be ideal. Yeah,
Right.
spend some time on really improving the quality of your nutrition and taking these supplements. There's other supplements like N-acetylcysteine is also known as NAC, NAC. I know it's a tongue twister, N-acetylcysteine. That is an antioxidant as well, and it's an amino acid that's actually been shown to help improve egg quality and ovulation.
Oh, wow.
So that's a really good one too. And then if you don't eat fish, I do recommend taking like a fish oil supplement. That is the DHA that you get in a lot of prenatals is in fish
Yeah.
or in egg yolk.
Awesome.
And that has been shown to really help with egg quality too and ovulation.
Cool. So somebody asked this, and then we also took CoQ10.
Yes, that's a good one too. That can improve egg quality. And for people with PCOS, it can help improve insulin resistance too.
Oh, wow.
Yeah, there's so many.
So these are all like cool to take together at the same time.
Yeah,
Because
I mean, we always recommend talking with your doctor. But yeah, these are safe to take together. Absolutely.
yeah, it
And a
sounds,
lot of like prenatals might even have some of these in it.
yeah, finding a good quality prenatal is really important. Um,
Yeah.
the prenatal, I take postnatal right now, and
Okay.
the postnatal that I take is specifically for lactation, and it's
Oh, great.
pills, so it's a lot, but they all function different.
Ah,
One is exclusive. I think one is it exclusively. I think maybe vitamin D, and it's got like a ton of vitamin D because you want it to pass through your milk. Because
right.
otherwise the pediatrician recommends putting newborns on vitamin D, and I was like, oh no, I got
Liquid.
a ton of vitamin D going on.
Absolutely. And you know what else we see in pregnancy? That by the time a person delivers the baby, that their vitamin D levels are depleted.
I mean, everything's depleted once
Right. Let's face it.
is gone, and you're just
The
like
iron's gone. Yeah.
everything is gone.
Yeah. And I actually have a PCOS prenatal in the PCOS Nutrition Center supplement store.
I know
And
that you.
it's only one pill, one capsule, and it has all that methylated folate and vitamin D, higher levels of vitamin D, iodine, and choline.
Then we don't have
So
to
if you
take
can,
12
yeah,
pills.
exactly. That's the idea. That's the idea.
Perfect.
Yeah.
Okay, I just want to see if people have here. Somebody asked, is it common to have high testosterone and estrogen dominance at the same time?
You can definitely in PCOS.
Oh,
Yeah.
wow.
And then what we're also seeing in PCOS is that progesterone tends to be really low in
Mm.
PCOS, and progesterone is the calming hormone.
And isn't that like a common cause of miscarriage?
It is. So a lot of times doctors, your fertility doctor might have you on progesterone to help, in that first month after you get pregnant.
If you do IVF, you're going to be on a lot of progesterone.
Yeah.
So because it wasn't my natural cycle, because we did reciprocal IVF, I had to take progesterone in oil, which is a giant shot in the butt, and progesterone suppositories, which is just disgusting. Um, but I remember just every time being like, it's keeping the baby in there, it's helping the baby grow.
Oh yeah. And it wasn't forever, right? You just have it for like the first month?
No, I had it until I was 10 weeks.
Okay.
So just because
First trimester. Mm-hmm.
doing any of it on its own, because with reciprocal IVF, at least how we did it, we kind of like manipulated the cycle. So my brain wasn't like, oh, we need to produce this. So
Yeah,
yeah.
yeah. And when progesterone's low, then your estrogen is more unopposed. And so then you have higher estrogen levels. Yeah. It's a
All
problem.
the body that you have no idea about. Okay, here we go. Somebody said PCOS and hair fall. Does that mean hair loss?
Yeah. So a lot of times when you have high testosterone, it can cause hair loss in PCOS. Usually it's like a receding hairline or at the part, a lot of thinning. Actually, zinc is really good for that, for improving the quality of your hair because it inhibits testosterone.
Oh, I should write that down because
Yeah.
that's right. Then I have all my pet postpartum hair.
Right. It's coming in.
Is so
I
beautiful.
saw somebody asked about Ovacitol, and that is an inositol supplement. We sell it at the PCOS Nutrition Center. And inositols are really helpful for improving egg quality and ovulation and PCOS as well. So that is definitely a go-to supplement if you're trying to get pregnant and you have PCOS. It has both myo and inositol in levels that mimic the body's ratios. Yeah, it's important for egg quality and ovulation.
A lot of
And
things. I think that what
yeah,
I'm getting from this is that there's a lot of things that you can do.
there is.
That's amazing.
Yeah,
That's incredible. Never a guarantee, of course, but like there are things
it
that
all helps.
and even if you don't have PCOS, you want those eggs to be the best quality possible every time, every cycle. So
Right.
even if you don't have PCOS, all of these things can still benefit, right?
Yeah, absolutely. Yeah. And it's not just nutrition. Like we know that exercise plays a good role in ovulation, like not doing too much strenuous and not doing too little, but being active is really helpful for ovulation and PCOS.
Did not
And
know.
sleep. Sleep is so important. We see that sleep problems are linked to infertility.
Really?
Yeah.
Huh. Well, when you've got kids, it doesn't really
What sleep? It's overrated.
exactly. Okay, we have another question here. So somebody said, what's an indicator that your PCOS is getting worse?
Uh,
There's a follow-up to that.
yeah. So some signs that PCOS is getting worse is is still experiencing weight gain, and you're experiencing the hair loss. Acne is getting worse. That would be a sign of it.
Okay.
Yeah.
So that's just like the outwardly kind of things that we can tell, besides
The
going in.
signs and symptoms, and if the doctor does monitor you on blood work, like looking at your diabetes risk factors, because as we talked about at the beginning, that there's an endocrine component to this.
Okay.
So checking your glucose and checking for diabetes and even cholesterol, fatty liver is really common in PCOS as we get older. Being exposed to high levels of insulin can cause some of these problems, but again, all of these can be modified and
Right. And then the follow-up to that was, what is the worst thing that can happen to women with PCOS?
yeah, it does. Yeah.
Yeah. So the follow-up was what's the worst thing that can happen to people with PCOS?
What's the worst thing? Well, it depends on your goals. Like if you can't get pregnant, that's a big one. For some, it's just devastating if you can't become a parent on your own. Um, Other things is there's a really high prevalence of type 2 diabetes.
Mm, okay.
So that would be, yeah, I think there's a statistic that by age 40, 50% of people with PCOS will develop type 2 diabetes.
Wow.
Yeah.
Holy moly. I didn't.
Yeah. So yeah, so a lot of people, doctors sometimes just focus on the fertility part and then send you on your way after you have kids and stuff, but you got to keep an eye on that throughout the rest of your life, is looking at, these metabolic risk factors.
Oh, yeah, okay,
Mhm.
people were asking about the different meds and supplements that you mentioned, and they're all on your website, PCOS
Yes, I
Nutrition.
have a blog
That.
that has information with all the references on these, and I have a whole supplement store where you can find a lot of these vitamins too and
Cool.
supplements. Yeah.
Somebody said my fertility doctor is only focusing on losing weight.
No, I
Well,
hate that.
uh,
I hate that.
find a new one.
Find a new one. We can help you out. You and I can hook you up.
Go email Angela right now. She's got you.
Yeah. That's so hard to be blamed. All of these that I've been talking about today, you can do without, focusing on the weight. And that's my approach at the PCOS Nutrition Center. I
Yeah.
really take a non-diet approach to taking control over PCOS.
Amazing. Because I mean,
Yeah,
the point isn't weight loss. That could be, that could also happen, you know, but that's not the point. The point is your health
right.
and, getting everything to function correctly and having your hormones regulated and all of that. And sure, maybe that will also happen if that's, a struggle or a result of the PCOS, but it's not the, okay. Somebody asked, and maybe this is not your approach, but said, how can you lose weight with PCOS insulin resistance?
Mhm. So that's what's really hard is insulin is a growth hormone, so it's promoting fat storage, which is weight gain. So if you're in fat storage mode, it's really hard to lose weight, and that's why I don't recommend. I don't focus on weight loss for PCOS. I focus on all the other lifestyle factors, which can help. Some people do lose weight with making these changes. And I think a big key is focusing on the insulin, and the supplements that I actually talked about today do have the ability to lower your insulin.
Okay.
Yeah.
Got it. Okay. And PCOSnutrition.com is where you can go find the supplements and articles on what each of the things are, everything that you talked about. You have a pretty robust blog. So, okay, great. And then let's see here. Somebody said if you go gluten and dairy free, that they actually lost a stone, and I don't know what that means.
That's a measurement in the UK.
No,
Yeah.
and I don't know how it converts here to pounds, but says the lightest that they've been in years.
Yeah. I mean, gluten-free and dairy-free is really being touted on the internet as being a solution for people with PCOS, as far as weight loss or improving symptoms. There's actually no research that really supports it, that a gluten-free diet is better than any other nutrition approach. However, if you found that that works for you and that you feel better without gluten, then that's really important to look at. But it's not a recommendation I would give to all people with PCOS.
Right. It
So
depends.
it's really important to take an individualized approach.
Yeah. And you work with people one-on-one too, right?
Absolutely. Uh-huh.
Awesome.
Yeah.
Somebody said, can PCOS make your estrogen low? I always have a thin lining.
Yes. So, and that's part of why we give progesterone to help with that implantation
Yeah.
with pregnancy. Yeah, to balance out the estrogen.
Somebody says, any way to improve, what does this say? Hirsutism?
Yes.
I don't know what that
So
means.
hirsutism is excess hair growth. And so some people will get sideburns, they'll get the like lip hair, chin hair is a big issue. They'll get hair in the central part of their body, like between their breasts or inner thighs. That's a big area for extra hair growth, and that's because of the higher testosterone.
So some people are losing their hair and some people are growing hair. It's like, and
It's a crazy condition. So treatments for that, if you're not trying to get pregnant, there's actually a medication called spironolactone that can significantly reduce the hirsutism. Now,
okay.
some people want the hirsutism, right? It's an advantage if you want the hair growth.
Right.
But zinc is also really great for inhibiting testosterone too.
Okay.
So check that out.
Got it. Whew. Okay.
So much.
There's a lot of stuff here. Yeah. Does oral progesterone cause weight gain?
I don't believe it should. It depends how much you're taking and how long, but I mean, everybody's different. I suppose if you're taking it long term, it could have that potential, but it's so important for pregnancy and
I mean,
yeah.
it, hormones can make you crazy.
Oh yeah.
I mean, it can make you, hormones can make you hungry. I mean, like, think about like different times of the month when you're just like ravenous and,
Yeah.
so, okay. Lots of questions, guys. This is great. Is there a link between PCOS, back pain, and headaches?
Not necessarily, but it could be, I mean, back pain could be related to so much stuff. We're sitting a lot at our desks. It could be related to an autoimmune condition that can cause back pain. Headaches can be caused by food sensitivities, fluctuations in hormone levels. So, yeah,
Possibly because of hormone fluctuation,
absolutely.
not necessarily.
Absolutely.
Mhm. Somebody said, do you have any information on an MD prescribing natural progestin? Did you mean progesterone?
They can do like a compound cream. Some doctors will do a progesterone cream instead of taking
Okay.
oral medication.
Okay. Um, Somebody said, can my dietitian help convince my doctor to take the risk factors seriously and test me for this? You might want a different doctor if they won't test you for
Yeah, if
it.
they won't. But, I'm a dietitian, so, definitely asking for that is going to be really important. Otherwise, seeing a different doctor.
Right.
Yeah,
Definitely. Okay. Somebody said I have PCOS and type 1 diabetes, so it's really difficult for me to lose weight.
yeah.
Yeah.
And again, you don't have to focus on the weight loss. There's so many other aspects to PCOS to focus on.
Yeah. Someone said, can you have PCOS and still be really slim?
Absolutely.
Me. I have very good genes.
Yeah.
Thank you, me and daddy. Um, Somebody said, have you heard of, I'm going to mess this up, Gymnema sylvestre?
I don't know about that one.
I
I
might
think
have
that's
just
a supplement. Yeah.
botched that.
Yeah.
Okay, here we go. What about saw palmetto?
Saw palmetto can potentially help to lower testosterone.
Okay.
There's not a ton of evidence for it, and it's really important if you're trying to get pregnant. You really want to talk to your doctor about these supplements
Yeah.
because when you're undergoing fertility treatments, they really have the potential to alter other hormone levels. So
Yeah.
you really want to work with a qualified practitioner that knows what they're doing. Don't just like read about it on the internet and say, "Oh, this lowers testosterone. I'm going to take it."
Right.
You really have to work with your doctor and your dietitian and
Right.
do your research.
Got it. Okay. So somebody said, my doctor keeps suggesting I just go on birth control, but I'd rather correct the imbalance. I guess a different way. She said, my estradiol is very low. What is a good place to start in seeking an alternative?
Yeah. Check out our website because that inositol, like Ovacitol supplement, can really be helpful for, I would say 90% of my patients with PCOS who don't get a regular period. When they start taking it within 3 months, their period comes back.
Wow.
Yeah.
Oh, wow. And somebody said, I'm on day 95 of having my period. And my
Oh my
doctor wants,
gosh.
they said, my doctor wants to put me on the pill to stop it. So what do you think about that?
Yeah, or sometimes they'll give you some other hormones to stop it. You don't want to keep bleeding like that.
Oish.
That's,
I'm
that's awful. I'm so sorry.
Um, okay. Somebody said, do you have experience with, oh, yeah, you do. Inositol. There we
Hmm.
go. What what can I use for hirsutism, the hair thing? So,
Yeah, so that's what we talked about earlier with the
and
spironolactone. Zinc
okay,
can really help with that. And
yeah,
again, any of these questions, you can go to the PCOS Nutrition Center and do a search, and you're going to see a lot of stuff there.
okay, awesome. Um, let's just see if there's anything else that we haven't really covered. Whew, we have a lot of questions. Oh, can
I
you take
know
an
PCOS.
during pregnancy
Can you take an inositol?
while you're
Is that
pregnant?
Yes, you can. There is some evidence that shows it can reduce gestational diabetes,
Hmm.
but I always recommend talking to your doctor first.
Absolutely. Um, oh, this is interesting. And then we can wrap it up when you have to go. Is there a link between PCOS and having a baby with autism, like a higher chance?
There's a very weak literature that shows that um, babies born to people with PCOS might have higher rates of autism, very slight
Okay,
increased risk. Same with ADHD, there's a little bit of evidence for that too.
got it.
But, it's very slight.
Got it. All right. All right. Well, we went through a ton of questions, and if we didn't get to it, it's probably because the answers are on your website. So I just want to be conscious of everyone's time, and you have so much information on there, all these supplements on there that, you've like specifically developed, for people with PCOS, or if you're just looking to improve your egg quality, because you might have poor egg quality unrelated to PCOS, but these can still help. So thank you so much
My
for,
pleasure. This was so fun. I love talking about PCOS.
I mean, I learned a lot. I'm learning so much by like talking to people and, just their expertise, so many little things that we can do along the way, to help expand our family, because that's really, what everybody is kind of here to learn how to do and all that good stuff. So thank you. Thank you again.
Thank you. Such a pleasure.
Right.
Goodbye.